Now we move to the next type of osteomyelitis, and this next type of osteomyelitis is what is known as a pyogenic osteomyelitis. Okay, so if I'm going to explain this to you from a student point of view, pyogenic osteomyelitis just simply means a type of bone inflammation. So this bone inflammation has been there for a very long time that it has actually turned pyogenic, like there's pus formation now. Okay, so you can see there's pus formation in the bone. So it's just an infection of the bone, okay, caused by what? Pyogenic bacteria. So of course the pyogenic bacteria will actually become pus forming. Do you understand? So most often you're talking about Staphylococcus aureus in that class. So it will start with inflammation, the bone cells will start dying, then you start forming pus. Then you see that the bone is also trying to retaliate by forming new bone. So mostly it's caused by Staphylococcus aureus, Streptococci species, then Escherichia coli, Pseudomonas, Klebsiella. So they usually get to you through blood, through direct inoculation, contagious spread. Okay, so pathogenesis, the bacteria has to enter to you too first, then there's inflammation, there's bone necrosis, the sequestrum will form, involucrum will form, that's new bone, then there's abscess formation, then a sinus tract to be formed to leak out the pus from the place. Okay, so morphological features, in the acute phase you could actually see suppurative inflammation, then marrow necrosis and edema. Okay, so chronic phase, this is where you can actually outrightly see a bone that is kind of like dying off. Okay, there you see new bone being formed around it. That's what is known as what? Sequestrum and involucrum. Then sinus tracts could actually form from the skin. You have a tract from the skin, okay, that's from the bone right to the skin. Okay, so that pus will kind of like be coming out. So issues that you can actually get where you have pyogenic osteomyelitis include things like fever, malaise, leukocytosis, local pain, swelling, tenderness, right? Then of course you're not actually using that limb like you used to use it before. So complications, it could lead to amyloidosis, it could lead to septicemia, where the bacteria gets into the bloodstream. Then squamous cell carcinoma in sinus tract. Okay, then chronic osteomyelitis, where your bones are actually getting weak, could actually fracture. So you see that's chronic osteomyelitis with this thing, deformities.